Gage from crushbackpain.com. This video is going to cover 13 exercises that help sciatica. We're breaking the exercises up into 4 different categories. The first category covers exercises that help reduce pain. The second category covers exercises to promote healing of the disc and the nerve. The majority of the time, sciatica is caused by a herniated disc that irritates the nerve. The third category is going to cover exercises that improve function. And then the fourth category is going to cover exercises that reduce the likelihood of having sciatic symptoms in the future. For the pain relieving exercise category, we're going to look at 2 different movements. The first are prone press-ups. If you Google sciatica exercises, you're going to see some variation of a prone press-up. So we're going to cover prone press-ups and prone positioning. The prone position is known to centralize sciatic symptoms. That just means the pain moves up from farther down in the leg towards the foot to farther up towards the spine, or the pain in the leg decreases, or a combination of both. That's all centralization means. So as far as the prone press-up goes, you just get in a prone position and you just press up, and you can hold in that up position for 2 or 3 seconds and then come back down. And you just take your time with this. You're not trying to force your back into full extension. You're just working through a comfortable range. As you do reps with this, what you're looking for is that centralization of the leg pain. Now, there's a lot of variations. If you have pain on the right side, you'll see it taught where you can get that right leg up in this position and do the same thing. Sometimes that works. I try the other just normal way first. If it doesn't work, try this. If it hurts too much to press up into that prone position, you can also just get in a prone lying position and not press up. And sometimes just that is enough to centralize those leg symptoms. The important thing with the prone press-up work is that it centralizes the leg symptoms. That's what you're looking for. If it does, then you absolutely want to use it as a tool to address the sciatic pain. The second option is a 90-90 decompression position. This is super simple. I'm going to show you on the treatment table. At home, you can use a bed, a couch, a chair, whatever you have. But this just gently decompresses the disc, which can really reduce sciatic pain. So you literally just get your feet up on, I'm going to move this down a bit, just get your feet up onto a surface that allows the knees and hips to be around a 90-degree position, and then you just lay there. It's that simple. You can lay here for 5-10 minutes, and again, what you're looking for is a reduction in the sciatica pain, in the leg pain. If that happens, then this is definitely a position that you want to use as a tool to reduce your symptoms. So those are the 2 primary pain relieving exercises that you want to look at when you have sciatica. Next, we're going to look at exercises that promote healing of the disc and nerve. The first exercise is just simply walking, and this is often overlooked, but it is one of the most underrated exercises that there is for sciatic symptoms. If you walk quickly, briskly, with arm swing, several things happen. You get a lot of load sharing through the spine, which is actually healthy for the disc. It facilitates and promotes the healing process. And with that arm swing from the shoulders, you're engaging the core in a functional manner. And that helps the healing process along too. There's also some weighted walking for bulging discs. That would be later on in the process. Once the sciatic pain is gone or it has centralized considerably and it's no longer activity limiting, you can look at the weighted walking with, the brisk walking with arm swing. I've got that video here. And then I also have the weighted walking for herniated or bulging discs, and you can check that out here too. So look at those to go more in depth there. And then sciatic nerve flossing or sciatic nerve mobilizations are what we're going to talk about next. There's a lot of different ways to do these. These are another exercise that you're not going to want to incorporate until the symptoms are lessened. So not super severe, they're still present, but they're manageable. So, because this sciatic nerve flossing or sciatic nerve mobilization, it does have the potential to increase the symptoms to a degree, and that's okay. We know that can happen. If it does, we just want to make sure it doesn't linger for a long period afterwards. So, a lot of different ways to do these. You'll see them in sitting. You'll see them laying down. I'm going to show you different variations. But so like laying down, if I had left side sciatica, I could basically just kind of hold my left hip in 90 degrees of flexion, and then I could extend my knee. Now, as you extend the knee, you're putting tension on the sciatic nerve. So you can point your toe as you straighten your knee, and then as you bend your knee, you pull your toes back or pull your foot back. So that's what we call a slider. You're kind of sliding the nerve through the tissue and putting tension on the nerve at the knee, but taking it off at the ankle. So that's kind of where you want to start. Now, you can do the exact same thing in sitting. So you can sit and literally do the exact same thing. Straighten the knee and point the toe, bend the knee and pull the foot back. That's where I would start with these. Maybe, a couple sets of 8 or 10. You don't have to be really high rep or aggressive with these. If it increases your sciatic pain, know that's normal, but you don't want it to increase the pain for 20-30 minutes after you stop. So say you do a set of these sliders, these nerve flossing exercises. You're like, yeah, I can feel that pain. It's a little more noticeable. You stop the exercise, it goes back to baseline. That's fine. That's expected. On the flip side, say you do your reps and you notice an increase in pain 20-30 minutes later, you still have increased pain. It's not ready. Revisit that in 3-4 days a week and test it again. Now, that's the slider. When you get where you have even less pain, you can be a little more aggressive. And as you straighten the knee, you can pull the foot back. That's going to put tension on the nerve at the knee and the ankle. There's going to be more tension on the nerve. So that one I wouldn't do until after the first one doesn't really cause you a lot of problems. So those are the sliders or tensioners, the sciatic nerve flossing that you'll see. So those two approaches help the nerve heal and the disc heal with the walking part. And those are exercises you're going to want to look at in that subacute phase when you still have some symptoms, but they're not as severe. Next category we're going to cover are exercises to improve function. So this is when you've gotten past the activity limiting sciatic pain, leg pain. Symptoms are centralized. You probably still have some lower back pain, might still have some pain in your buttock, maybe even a little bit in the back part of the thigh, but you're trying to improve function, get back into your normal routine. So we're going to cover 3 exercises. We're going to look at the forward lunge, walking, or just in place, alternating. We're going to look at a neutral curl up and also a bird dog. So these are exercises that the first one, it obviously is a leg exercise. I really like lunges because a lot of times people with herniated disc sciatica can get away with lunge variations without a lot of increased symptoms. The lunge lends itself to maintaining the lumbar spine in a neutral position, which is really important with herniated discs, bulging discs, and also with sciatica. So as far as the forward lunge goes, I mean, pretty straightforward. Everybody knows what a lunge is. I like it alternating because you get that back and forth motion, which is, facilitates load sharing. It's good for the back. Super simple. So, nothing new there, but you can do it alternating in place. You can also do it walking. You're going to get some good leg work, good core work. It's forward lunge, alternating or walking. The next one is the neutral curl up. You guys have seen these. I mean, this is just a basic core exercise, but for people with sciatica, we obviously need to work the core to rehab the situation, the problem, but you don't want flexion through your lumbar spine. So a neutral curl up just means the lumbar spine stays neutral, it doesn't flex. One knee up, one down, that helps maintain that lower back in a neutral position. You can take your hands and put them under the small of your back. The whole key with this exercise is you engage the front part of your core, your rectus abdominis, and you just come up a little bit but your spine doesn't smash into your hands. So my hands are under my back here. If I come up and I'm really smashing my hands with my back, that's wrong. That's going to irritate the disc, possibly irritate the sciatic symptoms. That's what we do not want. So, I mean, like if I just come up like this, I really feel my core work, but I don't feel my back round out and push into my hands. That's the key. Now, once you get this down, if you need to support your neck, that's fine, or put your hands somewhere else, that's fine. But initially, you want that feedback. You want to know that you're not smashing the back into the hands. And then the third exercise to improve function that we're going to talk about is the bird dog. This will work, the posterior chain, back part of the core, lumbar paraspinals, multifidi, glutes. So the key with this is you get that lumbar spine in a neutral position, which is going to be the most comfortable position for you. So you can rock your pelvis around, figure out where you like it, and then pretend there's a glass of water back there. You don't want to spill it. And then it's just opposite arm and leg. So you're not here, you're not here. It's just a nice, smooth motion, slow and controlled. All the motion comes through the hip and opposite shoulder. Lumbar spine is stable. So those are the 3 exercises that you can focus on to improve function. Last category we're going to look at are exercises to reduce the likelihood of having sciatica in the future. So these are more just core, lower extremity, kind of whole body strengthening exercises that focus on lumbar stability. And that's key. The more stable your lumbar spine is, the less chance you have of a disc herniating, and it's a herniated disc that usually causes sciatic symptoms. So we're going to look at alternating forward lunge. We already talked about that in the last section. Same exercise, so literally just lunging, alternating, and you can do that walking. At this point, you can load it. You can hold dumbbells, you can hold kettlebells, you can hold a kettlebell in a front rack position. You can even load it with a barbell on your back. Any of those things, you can load it as you feel needed. Alternating reverse lunge, I like these. So just the opposite, you're just going back and forth. Same deal, you can load it. Dumbbells, kettlebell front rack, barbell on your back, however you see fit. Loaded carries, I'm a big fan of these for the core. I've just got a simple dumbbell here. You could use kettlebells. I like doing it unilateral, having the weight on one side because that engages the core more effectively. So have, a 30, 40 yard runway, or whatever it is you have access to. It doesn't have to be that long. You go down and back several times with the weight in one hand, switch it to the other hand. What you're trying to do is stay tall. You're not wanting to lean to either side, so you don't want to wait where you're having to really, lean to walk with it. You want to be able to just walk and stay tall, vertical. That's a great exercise for the core, super functional. So those loaded carries are great. Side plank, it's going to work those obliques, quadratus lumborum. Real simple, stack the feet, or if that's too difficult, top leg over bottom. You're coming up and you're holding. And you can come up like this. Obviously, the longer you hold, the more difficult it is. When you feel yourself start to sag, terminate the set. So you want to do that on both sides. Side plank, great isometric movement. Super, super effective movement for building that core stability without putting a lot of compression through the disc. And then the last one we're going to talk about is the hip hinge. This is super important, especially following a bout of sciatica. You want to use the hip hinge as a movement pattern. You don't want to hinge through your spine. So, dozens of times a day, we're sitting down, we're standing up, you wake up in the morning, you're brushing your teeth, you're bending forward. You don't want to bend through your spine, you want to bend through your hips. So you can also use the hip hinge as an exercise, and you can do double leg, single leg, but it works all those back muscles, and it works the glutes, hamstrings, whole posterior chain, which is important. So I mean, this is all a hip hinge is. It's essentially like a deadlift motion, but you want no movement through your spine, all the movement through the hip. So like when you bend forward, once you get to a certain point, you should feel a pull through your hamstrings. You shouldn't feel your back stretching. If you feel your back stretching, you're not hinging through the hips, you're hinging through your spine, and you're doing it wrong. So, you can literally use a hip hinge like this as an exercise, body weight, and you can load it with, again, whatever implement you have. Dumbbells, kettlebells, barbells, whatever. But the whole key is you're hinging through the hips. Now, you want to make it more challenging, you can do a single leg hip hinge. Everything's the same, you're just on one leg, so there's a balance aspect. But again, all the motion comes through the hip. You're not moving through your spine at all. So those are good exercises to focus on after you don't have symptoms anymore and you're just wanting to build a strong core, strong base, strong legs, and you want to reduce the likelihood of having sciatica in the future as much as possible. So we covered 13 different exercises, 4 different categories to help address sciatica through the different stages of the healing process. If this video helps you, leave a thumbs up, and if you have any questions, comments, drop them below.